I entitled this talk, The Primary Care Optometry in the New Normal. No, kasi ito nga yung sinasabi natin, prior to the pandemic, marami ng studies na ginagawa with regards to digital problems, no? Particularly digital eye strain. And in this world na ngayon, problema na prior to pandemic, mas naging problema pa ngayon na na-lock up tayo sa bahay natin. And so, yung sinasabi nilang ito na yung new normal. What is the new normal? New normal, no? Yung new normal life natin demands more from our vision than ever before. Bakit kanyo? It's because imagine nyo, hawak-hawak nyo yung device nyo, nasa kamay nyo lang, yung mga gadgets nyo nasa kamay nyo at napakalapit sa mata. Nasa laptop tayo, doing whatsoever work or school work, no? Mga bata nasa iPad, nasa tablets, no? So, hindi natin naiintindihan bakit sila nagrereklamo ng sakit ng ulo or kung ano man. And this translates to different facets of how we should look at our eye care system right now. No? So, even optometrists, medyo nag-evolve na kami because of this, itong ang bagong kalaban. Na nung time na nag-aaral kami, wala pa naman to, hindi pa natin to pinag-aaralan. Pero right now, nag-evolve na rin siya. So, because of the pandemic, we are forced to work home. Na-force ang lahat ng kabataan. Dati, choice mo pa kung gusto mo mag-homeschool. Right now, every children are forced to homeschool. Kahit pa naka-enroll ka sa big school, practically homeschooled ka pa rin. Because wala, bawal ka lumabas. Para makapag-aral ka, kailangan nasa computer ka. No? And so, we have our laptop here, we have a desktop, we have a tablet here, we have our cell phone, and what does it mean? It means that below around 6 to 8 inches, hawak natin yung cellphone natin. Ewan ko kung nakikita nyo ako, hawak ko yung cellphone, nakaganito ako nakatingin. Alright? And that is around 6 to 8 inches. Tapos, pag nagta-tablet tayo, I also have my tablet here, medyo mas malayo, pero below 12 inches. Okay? And I have my laptop here, which I am now using. It's around 16 inches. Or minsan below 12 to 16 inches. And meron tayong, let's say, monitor, no? Pagka tayo ay naka desktop computer, is around almost up to 20 inches. So ano mapapansin nyo?
Doc John, may I ask, is there a difference yung effect sa eyes if like whether you are using a small screen na cell phone and whether we are using a larger monitor? Kumbaga, is a larger monitor safer na it will cause less digital strain than the cell phone?
Actually, sa ngayon, medyo pinag-aaralan pa rin siya deeper. Pero, to answer that in a simplistic manner, yes, it has an effect because imagine mo, kung ikaw tumitingin ka sa napakaliit na mga imahe, mapapansin mo parang merong certain distance that you will not be able to see it, and there will be a certain distance that you will be able to see it. And that alone, that change of distance has an effect on your eye already. Actually, napakaganda na well-lit ang kahit anong tinitignan natin. So, pagka sinabi mong backlight pero ginawa mo naman, tinodo mo naman down yung lighting, it has an effect as well sa mata. Mapapansin mo na mas kakailanganin mag-strain ng mata for it to see clearly. So, well-lighted area is best really.
Okay. So mas maganda we open our regular lights, like if we're in the room, mas maganda na may ilaw kaysa yung madilim yung kwarto tapos puro cellphone lang ang tinitingnan. Tama
Yes.
po ba?
Yes.
Okay.
Mas maganda ang naka-open pa rin ang room light.
Okay,
Tapos
sige.
kung nag-aaral ka, maganda kung meron kang lamp, no? That focuses on your paper, no? Mga ganyan. Sa internet, left and right, nagbebentahan ng mga blue light filters. And meron pa talaga siyang effect. And again, to answer it in a simplistic manner, yes, it has an effect. The blue light practically causes glare. And
Kaya
so,
pala yung sunglass, yung pangit pag blue yung sunglass, di ba?
oo. At saka, hindi lang sa sunglass, kaya mapapansin mo, kaya gusto nilang nisosoften yung ilaw ng gadget because pag mas malakas ang ilaw mo, yung effect nun sa mata natin, mas glary because it enhances the blue.
I see.
Although
Okay.
hindi natin nakikita kasi white light siya, no? Pero it enhances the LED light kasi enhances the blue light. And so glare is enhanced. And so pag nag-enhance ang glare, nag-enhance ang light, nagkakaroon ng mga reflection. And that reflection causes glare. Pero ang main problem natin with blue light is the disruption of our sleep pattern. Yung tinatawag natin na circadian rhythm. Diba? So, it disrupts.
So, nahihirapan matulog, di ba? Pag when
Yes.
you're using your cell phone. That's why there's an advice that you don't look at your cell phone probably 1 hour before you go to sleep.
Yes. Kasi ano rin eh, ang problema ng light that goes through our eyes is that it disrupts the melatonin production of the brain. So yung hormone na yon tells us, all right, gabi na, matulog ka na. So it decreases the production already. Pagka may ilaw, it tells our body, okay, wake up, time to work. No? So imagine pag patay lahat ng ilaw mo, naka-gadget ka sa mata mo, anong ginagawa mo? It tells your brain, wake up, hindi pa time to sleep. Yan. So yan yung problema. But ang problem natin right now, there are a lot of products out there na practically fools people lang into thinking that you are protected against blue light. Kasi you don't block the whole blue eh. Remember ang component ng white light is Roy G. Biv, di ba? The rainbow.
The rainbow
Red,
color.
orange, yellow, blue, green, blue, indigo, violet. So lahat na nandoon. So there is a harmful blue and there is a blue that is good for our eyes. So you have to have a glasses that will just protect you from the glare component of that.
So people who are wearing eyeglasses are better protected?
Eyeglasses that is optical grade. Kasi nakakalungkot ngayon, ang daming eyeglasses na ibinebenta online that is not optical grade. Kumbaga demo lens lang sila. Since demo lens lang sila, yung lens itself, okay, meron silang nilagay na coating, pero yung lens itself, walang kwenta.
Okay.
Kumbaga para siyang warp lens siya.
Oh. And that those kind of lenses will do more damage than correct the eye vision?
Practically, it will create more strain.
Okay. And of course, if there's more strain, di syempre, lalong masisira yung mata in more...
Pwede.
Okay.
So yan yung pag-uusapan natin next. So kasi kadalasan ang sinasabi, ano ba talaga? Ibang doktor sinasabi okay, ibang doktor sinasabi hindi. Ano ba talaga, 'di ba? Or minsan kwento ng kumare ko, 'di ba? Kwentong kutsero kung ano ko sino-sino. Ayan. So for you to understand, to have a good eyesight or vision, it should be na wala ka masyado na experience na eye strain. It should be that you don't experience headache. It should be that your productivity is increased during your working hours. And it should be that overall, your body, kumbaga, your brain tells your body that you are okay. Pero bakit bigla na lang may sumasakit sa kung saan-saan? Ibig sabihin, hindi ka okay. And so, ang main objective natin, and when we talk about digital eye strain, is that you have to understand gaano katagal ka ba nagga-gadget? And what is your working distance? What is the size of your task? Ibig sabihin, gumagawa ka ba ng thesis? Nag-aaral ka ba for an exam? Gumagawa ka ba ng homework? May ginagawa ka ba na presentation for your work? Kamusta yung lighting mo in your work area? Diba? And so from that perspective, you will understand ano pwede mong gawin. The need for visual breaks, no? The need for head and eye movement, the need for understanding the work of our eyes. Dalawang mata natin, remember, hindi po isa. So it should work together as a team. No?
Hindi pwede yung isa lang, no, ang nagwo-work. But some people, they have lazy eye ba yun? What you call it?
Yes. Actually,
so
lazy eye is a...
strain.
Oo. Pero ang main problema natin, minsan may mga tao, tinatakpan na yung isang mata kasi nahihirapan siya pag dalawang mata. Remember, this is not lazy eye, pareho silang okay. Pero tinatakpan yung isa para lang mas maging okay yung pag-focus niya. There's a problem. Kasi we have to understand, dalawang mata natin, we have to understand na kailangan sila mag-team up. Kailangan binocularly mag-work sila together. At paano mangyayari yon? Mangyayari yon when we have proper ergonomics, no, in our work area. When we look at a screen, meron niyang dapat medyo nakababa, hindi dapat nakataas. Meron ako nakita isang bangko.
Masakit dito sa batok.
Actually, nagtataka ako dati, itong bangko na pinupuntahan ko na to, yung screen nila nasa ilalim ng mesa. Ngayon, ginawa nila, binago nila. Nasa taas na. Ngayon, na nakikita ko yung teller, gumagawa nagtatype dito, tumitingin pataas. No? Kawawa. Kasi ergonomically, sobrang mali talaga siya. Wala siya
so the best position is looking down.
Yes, looking down to promote blinking. No, para ikaw nagbe-blink ka din. Kasi importante 'yun eh. Hindi dapat bukang-buka yung mata mo pag tumitingin ka ng mga bagay-bagay. Tapos yung posture mo is really straight, no? To promote back health as well and your neck. And so, to minimize eye strain, we really have to employ this rule, the 20-20 rule. Anong ibig sabihin nito? It's not because I'm an optometrist kaya ako pinopromote to. It's more of the idea na every 20 minutes, you stop from what you're doing. Naka 20 minutes na ba tayo sa ginagawa natin? Pag 20 minutes na tayo, we stop.
Tatayo na tayo.
Hindi naman kailangan tumayo. Maganda ang workstation mo nas in front of a window. You look outside.
Okay.
Look outside for how long? Alam mo, for 20 seconds
20
lang yan.
seconds.
Oo. Tapos, you look at far objects 20 feet or beyond. Yan.
Maganda pala view ko dito.
Oo. Di ba? Pero, after doing all those things, nag-proper ergonomics ka na, you do 20-20-20 rule, no? And still, hirap na hirap ka pa rin. You have to understand.
some
Okay.
people say na, 'di ba, when you are working, parang you rub your hands sa friction, tapos igaganyan sa mata. Is that good? Kasi parang 'di ba
Okay.
pagod, you feel tired, pero I don't know if that's a healthy thing to do. Kasi baka mamaya lalo namang nasisira yung mata dahil sa ganyan.
Okay. Actually, ang ginagawa nila, if they rub their eyes, it's more of hini-heat up nila yung kamay nila. Tapos ipapatong nila sa mata.
Yes.
No?
Oo,
Patong lang
tama.
ha, hindi pressed on ha.
Oo, oo.
Pagpatong, ang ibig sabihin nun, you are promoting warm compress. So ibig sabihin, hini-heat up mo, which is okay lalo na sa eyelids mo. Kasi pagka winorm compress mo siya, anong ginagawa mo? Ang ginagawa mo is that you promote na matunaw yung mga sebo ng eyelids
Okay.
para mapunta siya sa mata mo. And hindi basta-basta mag-evaporate yung luha.
I see.
So warm compress are good. I-employ
Okay.
din namin talaga yan. Lalo na sa mga dry eye patients namin.
Oo. I don't know nga kasi I have dry eyes. Ang napansin ko during the pandemic, parang bumaba yung eyelid ko.
Bumaba ang eyelids. Iba naman
Oo.
yon.
Okay.
Usually,
That's to do.
naglalax. Kasi ano to balat to na, kumbaga, syempre, balat, muscle, may taba, no? Lahat yan, naglo-lose yung elasticity niya. So pag nag-lose yung elasticity niya, yan, naglalag siya.
No. So a hot
Nangyayari talaga
compress
yan.
will help, 'di ba? Pag ganyan, the hot compress helps. Para matunaw yung taba, para
Pwede, pero kasi ito, yung mismong skin natin, naglalag na. So minsan, pag sobrang grabe na siya, it's kailangan na ng operasyon yan.
Kailangan ng surgery.
Oo.
Oh, okay. Naku, paano kaya ma-prevent? Anyway. Kasi iniisip ko lang, probably kasi we wear, kasi right now, di ba, we wear, ano tawag doon? Yung progressive lenses. So when you wear progressive lenses, kasi the tendency is really to look down di ba? So, does it contribute to that effect of the lowering of the eyelids?
Wala po This is really caused by aging.
Okay. Bawal tumanda. So, okay. So, if I have 20/20 vision, kulang pa siya, Doc.
Oo. Dito na tayo pupunta sa sinasabi ko. Lahat ginawa mo na, pero parang wala pa rin. Nagpatingin ka ngayon. Ang ginawa sa iyo, vision screening. No? So, ibig sabihin, 20/20 is not enough. Ang akala natin, pag 20/20 ka na, perfect vision ka na, okay ka na. You have to remember, our eyes, our vision is not 100% sensory. Balance yan ng sensory and motor. Which means, your sensory should function well, that's the 20/20, and the motor should complement that 20/20 vision. Pag may motor problem ka, then marami kang mararamdaman.
So imagine mo din yung exercise ng eyes kasi that's the motor skill, so we have to exercise.
Yes, exactly.
Kasi look up, look down.
Pag nagpunta ka ng isang vision screening clinic, ang gagawin lang sa'yo, okay, papabasahin ka. Malinaw na ba? Papabasahin ka, tapos lalagyan ka ng mga lente. Pag luminaw na, sinabi mo malinaw, 5 minutes tapos na, uwi ka na. Nakasalamin ka na. Pag uwi mo, bakit hindi ako umuokay? Nagdodoble pa rin yung paningin ko, sumasakit pa rin yung ulo ko. Kasi vision screening pa lang ang ginawa sa'yo. Ibig sabihin, nakapag 20/20 ka pa lang, which is 50% already, no? Sensory-wise, okay ka na.
So
Pero
kulang
motor-wise,
yung procedure for a perfect,
oo.
kumbaga,
So
perfect
kailangan mo pa,
eyeglasses. Mhm.
exactly, kailangan mo pa ng additional test.
Mhm.
And doon na papasok yung comprehensive eye exam.
Mhm.
No? So, natapos na yung vision screening, which is yung visual acuity, yung refraction nagawa na. Now, pupunta na tayo sa binocular function. Yung eye teaming, no? Kailangan mag-team up sila, dalawa nga yung mata mo eh. Kailangan mag-focus, parehong mata nakakapag-focus sa iisang bagay. At nakakapag-track ka ng binabasa mo. Di ba, nagbabasa tayo from left to right? If you are Chinese, if you are other race, yung basa mo right to left. Di ba? Tapos, okay ba yung color vision mo? Okay ba yung contrast mo? Di ba? So, everything should work together. So,
So Doc,
i-assess din pati yung...
this is the one na yung, di ba, tinetest yung eyes mo and then the computer printout comes out?
No, that is part of the vision screening lang.
Okay. So how do you test, how do you go about doing all these tests?
Ayun, napakaganda. Dito tayo papasok sa usapan nating comprehensive exam. So, sanay na tayo dito. Ito, nagawa na natin pag nagpapa-vision screening tayo. Di ba? Nilalagyan tayo ng mga lente. Ito yung sinasabi mo, nagpe-print out.
Tama.
Yan, this one. But this one, you have to understand as well, this is the motor function already. Is it teaming? When you look at something, are both eyes looking at the same object? Visual efficiency allows both eyes to work together in a precise and coordinated manner. Okay? Tapos, these are the tests that are involved in eye teaming. Tapos, ang gusto natin, when you look at far objects, it is clear. When we look at near object, it is also clear. The focus is good. Alright? And so, dito itetest naman natin yung ability of the eye to accommodate. Ibig sabihin, di ba napapansin mo, pag tumingin ka ng malapitan, nag-aano siya, nagfo-focus? Yan yung tinatawag nating accommodation. Alright? And so, after that, if you look left and right, di ba, you're reading a book, parang ganyan ba? Nagdodoble-doble? Or minsan nagsiskip ka? Natatanunan mo yung binabasa mo? Ibig sabihin, yung tracking ability ng mata mo, hindi smooth. Hindi siya accurate. Alright? And so, we are testing also the tracking ability of the eye. After that, color. No? Ito, alam na natin na kung nakakita ba tayo ng red, ng green, ng yellow, di ba? And
It's important, especially if you drive, di ba? Yung color.
Exactly. Driving. Imagine mo, pag hindi ka nakakita ng red, lahat nakita mo green.
Oo.
Green, dinag-go ka, patay ka ngayon. Di ba? Tapos, eye health assessment. Ito naman, makikita natin yung general well-being ng mata, yung health ng mata. Meron ka bang katarata? May dry eye ka ba? May glaucoma ka ba? May uveitis ka ba? Or any other illnesses in that manner. Okay? And so, if you undergo everything, mas maa-assess ka ng full. Mas makikita mo ngayon, alright, ganun pala yung dapat yung mata ko.
So, Doc, how often should the person get an assessment test?
The assessment, pinaka maganda is like the dentist, every 6 months.
Okay.
Worst case scenario, every year.
How long does an assessment test takes place?
It can be as fast as mga around 15 to 20 minutes or as long as an hour.
Okay.
Depende sa
Tagal din,
makikita.
Wala pang waiting time nun.
Wala pa. So, depende yan sa makikita sa mata.
Sabagay.
Healthy ang mata
How
mo,
complex, no?
how complex, yes.